So let's have a Q&A tonight on coronavirus. I'll go through the basic ideas that I think we all have to be aware of in order to ask appropriate questions, and then I can take questions from the audience on the issue of coronavirus. So with your permission, without further ado, I'm just going to dive in here. As we always try to do in the inner circle, I want to start with the biggest picture. God gave mankind a divine guide for how to live back at Mount Sinai 3,300 years ago. And that body of wisdom is called the Torah, and it consists of the written tradition, 5 books of Moses, and the oral tradition, which contains the entire lecture that Moses heard up on Mount Sinai. A Torah scholar, armed with the entire Torah, written and oral, possesses exactly half of what he needs to know how to live. Okay, what's the other half? That consists of the physical realities we face, the so-called facts on the ground. A true posek, a Jewish legal authority, needs to know not only what it says in the Talmud and the Code of Jewish Law, he needs to know the mitzias. He needs to know what actually happened. Was it a milk spoon that fell into a meat pot, or vice versa? Did Reuven try to take the garment from Shimon, or did Shimon try to take the garment from Reuven? We can only know how to proceed when we possess both a precise grasp of the principles, that's as detailed in the halacha, and at the same time a crystal clear picture of the physical facts. Okay, so now zooming in, the questions we all have about the coronavirus provide the perfect opportunity to practice this sort of stereopic analysis. If we gather all the facts and then we analyze them in the light of the Torah, then we can know exactly how God is asking us to respond to the current crisis. So that is going to be how I'm going to organize the next few minutes. First, I just want to review the facts about the SARS-CoV-2, or as it's sometimes called, the COVID-19, or sometimes we call it just the coronavirus. And let's see what happened. What is this thing? What happened? What do we know about it? Once we get all the facts on the table, then we can turn and ask, okay, what are the principles? What does the Torah say we should deal with such facts? Okay, let's start from early on in the story. This is not the very, very beginning, but it's probably the most famous turn in the story. Was on December the 31st, 2019, the last day of 2019, Chinese authorities sent a message to the World Health Organization about some unknown number of strange pneumonia cases in Wuhan City in Hubei Province, China. Okay. 3 days later, China reported a total of 44 cases. So we went from, as far as we knew at the time, 0 to 44 in a matter of 3, 4, 5 days. Okay, on January the 9th, 6 days later, there was the first death, a 61-year-old male. 9 days later, on January the 18th, those 44 cases had become 204 cases. They had multiplied by about 5. On the 22nd, 4 days later, January 22nd, the 204 cases had become 580 cases, more than doubled. And now there were 17 who were dead. 2 days later, on January 24th, the 580 cases had become 1,287 cases. And then neighboring countries began reporting cases too. 1 day later, on January 25th, the 1,287 cases had become 1,975 cases. And on January the 26th, 1 day later, the total rose to 2,801 cases, with 80 deaths. 1 day later, 2,800 cases had become 4,580 cases. That's on January the 27th. Okay, now you're starting to see the pace of infection here. Watch this. Between January the 27th and February the 1st, in China alone, the cases jumped from 4,580 to 14,380. And there were new infection clusters that were starting to appear in the Philippines, India, the United Arab Emirates, Russia, the United Kingdom, Sweden, Spain, and many other countries that were far from the Chinese epicenter. That was February the 1st. February the 5th, 14,380 cases jumped to 28,000. On February 11th, for the first time, 6 days later, the death toll soared past 1,000. And 8 days later, on February the 19th, it topped 2,000. There were 2,000 people dead already. On March the 7th, the number of COVID-19 cases worldwide soared past 100,000 in 100 countries. As of tonight, that's March 15th, 2020, there are more than 156,000 confirmed infections globally. And the vast majority of even those showing symptoms have yet to be tested because there aren't enough test kits, which means the numbers are probably much higher than 156,000. Okay, as of tonight, there are 6,000 dead with no end in sight. Okay, now when I say there's no end in sight, what do I mean? So I want to clarify, those words are precise when I say there's no end in sight. There are only two natural scenarios that we can fathom that could end the contagion. There could always be a miracle, but naturally, there's only two scenarios that lead to the end of this international disaster. Okay, the first is the arrival of an effective and safe vaccine. Okay, although there are teams around the world who are working on developing such a prophylactic, the earliest expected date of mass availability is about 18 months from now. Okay, now 18 months doesn't sound like that long. However, if you go back and review the numbers that I just read to you, if current trends hold true, with infections doubling about every 3 to 5 days, then before the vaccine would arrive, there would be enough time for the entire population of Earth to become infected and for more than 225 million people to die. Okay, that sounds extreme. All we did was take the current rates of infection and project them forward 18 months. And we're talking about hundreds of millions of people in mass graves. Okay, that is why the authorities are giving such serious attention to the only other known natural protection, besides a vaccine, which we're working on, but it's probably about 18 months away. The only other possible way of protecting ourselves is something that has come to be called in the sociology books social distancing. Okay, now, let's try to understand how social distancing works. I'm going to use a very famous case from 1918. That year, the city of Philadelphia threw a parade that literally killed thousands of people. Ignoring warnings of influenza among the soldiers who were preparing for World War I, the march to support the war effort drew 200,000 people who crammed together to watch the procession. 3 days later, every bed in Philadelphia's 31 hospitals was filled with sick and dying patients infected by the Spanish flu. By the end of that week, more than 4,500 people were dead in an outbreak that would claim as many as 100 million people worldwide. By the time Philadelphia's politicians closed down the city, it was too late. Okay, simultaneously, a different story played out in St. Louis, just 900 miles away. Within 2 days of detecting its first cases among civilians, St. Louis closed schools, playgrounds, libraries, courtrooms, even churches. Work shifts were staggered and streetcar ridership was strictly limited. Public gatherings of more than 20 people were banned. Okay. The extreme measures, which came to be known as social distancing, which is being called for by global health agencies today to mitigate the spread of the coronavirus, that system of restrictions kept per capita flu-related deaths in St. Louis to less than half of those in Philadelphia. By the way, everything that I'm telling you is according to a 2007 paper in the Proceedings of the National Academy of Sciences. By isolating healthy people from those who are infected with coronavirus, and by even isolating apparently healthy people from each other, so that carriers not yet showing infections can't pass the virus to genuinely healthy people, certain countries put the brakes on their rates of infection. Quarantines and other governmentally imposed social distancing practices in Hong Kong, in Singapore, and even in Japan led to infection rates today that are less than a quarter as high as places like South Korea, Iran, and Italy, where there was no social distancing put into effect at all. I'm going to send out to the Inner Circle members tonight a chart, a spectacular chart based on data from Johns Hopkins University, showing what happened in Hong Kong, Singapore, Japan, South Korea, Iran, and Italy during the days since their 100th case of coronavirus. And what you'll see is that Hong Kong, Singapore, and Japan, who imposed social distancing, put a cap on the disease. And South Korea, Iran, and Italy, who did not impose social distancing, their epidemics swung out of control and led to thousands and thousands and thousands of deaths, far more than in the countries that put restrictions on. Now, of really legitimate concern is that when you look at this chart, the United States, who has today failed to create social distancing protocols, so its infection rates since the 100th case in the US was identified exactly matches the curve of South Korea, Iran, and Italy, which means if the United States does not seriously clamp down now, there is no reason the virus should behave differently in the US than it did in those countries where there are thousands and thousands of dead. The United States is headed for an unmitigated disaster if the government doesn't convey to the population the genuine nature of the threat. It could be that in order to protect the stock market, the government might have underplayed a bit the level of the threat. But now's not the time to do that. If what ended up happening was that some US citizens ended up distrusting the government's calm assurances, and so those people have panicked and done crazy things like bought up all the toilet paper in the stores, which is ridiculous, and they're hoarding alcohol gel, right, etc. And then the other half of the population are the American citizens who actually trust what the government is saying, and they've been lulled into thinking that this whole thing is overblown and it's not that serious, and they're sure that there's no risk of dying, or the risk is ridiculously low, and therefore they're not taking any steps to protect themselves. Okay, now, again, as an interesting sociological contrast, last night, the Israeli government imposed one of the strictest social distancing programs anywhere in the world. And without going through all the details of their program, here's a snapshot. Anyone entering Israel goes into a mandatory 2-week home quarantine. Tourists wishing to enter Israel have to first demonstrate to an Israeli embassy or consulate abroad that they have a private home in Israel in which they can quarantine themselves. Anyone, Israeli or foreigner, who is supposed to be in quarantine and is found away from their quarantine base is arrested by the police and held in forced quarantine. This has already started to happen. More, last night, Prime Minister Netanyahu announced that the Israeli government is using digital technology. He didn't specify what sort of technology, but he said it was previously a technology that was only used to fight terror. And he went to the Misrad HaMishpatim, the Department of Justice, and got permission to use this with its own citizens. And they're using it now to identify, track, and quarantine anyone who may have inadvertently come into contact with coronavirus carriers. As of this morning, in a beautiful show of volunteerism, United Hatzalah launched an app on the Android Play Store called Virus Tracker that it tracks your position throughout Israel and retroactively notifies you if you happen to have been at the same location at the same time as someone who tested positive for coronavirus. All public events, from soccer matches to wedding celebrations to bar mitzvahs, are temporarily illegal. It is illegal for more than 10 people to gather for an event, any event. And minyanim have either been canceled or they've been restructured to allow only 10 people at a time to pray together. All universities, high schools, elementary schools, kindergartens, private childcare, special education, boarding schools, youth movements, and after-school centers in the country will be closed as of tomorrow. Okay, the grocery stores are open 24 hours a day. That keeps crowds to a minimum. And the government requires that in all such public places, like grocery stores where people are still going, individuals are required to keep a distance of 6 feet from each other. The government is encouraging us to wash our hands regularly with soap and water, scrubbing them for at least 20 seconds. We're told not to touch our faces, to cover our mouth and nose when we sneeze. When we sneeze, they say don't sneeze into your hand, sneeze into your inner elbow. People who are over age 60 or who have cardiopulmonary or respiratory issues should consider self-isolation, they've told us. Okay. The Israeli guidelines, as I mentioned, they ban daycare centers. So now what about private ganim that cater to small groups of children, less than 10 we're talking about, because over 10 is illegal. So these are not technically forbidden, and you could send your children there. However, since you don't know the hygienic practices in the other children's homes, or even if someone in one of those other families might not be feeling well, so even though it's legal, it might be wise to take advantage of this crisis to pull your kids out of Ghana and spend some extra time with them. Although technically you don't have to do that. If you follow the Israeli guidelines, in theory, because they were put together by top epidemiologists looking all around the planet and watching what's working and what's not working with coronavirus, if you sent your children to a private Gan with less than 10 children, the risk should be very low. Okay, one-on-one babysitting is even less risky because instead of being exposed to 4 or 5 families at a Gan, you're only exposing your child to one person in his or her family, the babysitter. Now, that's still not as safe as you taking care of your own child, but it's low risk. And especially if you insist that the babysitter wash his or her hands with soap and water before beginning, and you ask them to wash their hands with soap and water often during the session whenever they would touch their face or something like that. As long as you would feel comfortable with these options during an outbreak of cholera or bubonic plague, you can feel perfectly comfortable using these options today. These are the facts. Now, the Metzias, the facts, that is half of what we need to know, as I started in the introduction. So now let's examine the other half. What is das Torah in situations like this? What is the theory? What are the principles that we received at Sinai? So the Talmud in Tractate Ksuvas 77b describes the way that Talmudic sages would distance themselves from an infectious disease like this. There was a disease called Ra'asan, and the Gemara there, the Talmud in Ksuvas 77b says, Rabbi Yochanan would announce, "Be careful of the flies found in those afflicted with Ra'asan, as they are carriers of the disease." Rabbi Zera would not sit in a spot where the wind blew from the direction of someone afflicted with Ra'asan. Rabbi Elazar would not enter the tent of one afflicted with Ra'asan. And Rabbi Ami and Rabbi Asi would not eat eggs that were found in an alley in which someone was afflicted with Ra'asan lived. So we see back during Talmudic times, the sages were aware of infectious disease, and they practiced this sort of social distancing. Okay, now, let's move beyond social distancing. I want to talk about a really extreme sort of care that has been exercised in recent history. The rabbinical leadership in Vilna had to react to that region's 1848 cholera epidemic. In September of that year, cholera had killed many people in Lithuania. And although it was well known that hunger weakened people's immunity, none of the Vilna Rabbanim were brave enough to issue a blanket heter to eat on the upcoming holiest day of the year. So a Rav who usually remained quiet and stood on the sidelines, Rav Yisrael Salanter, on Erev Shabbos, October the 6th, 1848, Erev Yom Kippur, publicly paskined, he ruled that fasting the next day on Yom Kippurim was forbidden halachically. He had notices hung in every shul in Vilna announcing, and I'm quoting his notice, quote, "Not to fast on this holy and awesome day, to reduce the number of piyutim recited in the service, to go for walks during the warm hours of the day, and to help one another with one's physical strength, money, and counsel. Quote, unquote. You can imagine how controversial this psak was, saying that people should eat on Yom Kippur. And you can imagine the heat that he took from the other Rabbanim in his city, in Vilna. He was not put off. The following morning, Yom Kippur, Yisrael Salanter ascended the bima of the great synagogue after Shacharis, along with two of the most prominent Vilna Dayanim. In front of the entire congregation, he took out wine and cake. He recited the Kiddush on Yom Kippur, and Rav Yisrael Salanter and the two Dayanim all ate in the presence of the entire congregation. Yisrael then told the congregants, and I'm quoting again, "In the name of God, and with the authority of our holy Torah, which has woven one single mitzvah as a crown over all commandments, and you shall live by them and not die by them, we declare it permissible not to fast today." Yisrael then insisted that each person in the congregation come up and take a piece of cake. Rav Yisrael Salanter understood the primacy and the seriousness of our divine obligation to protect our lives. He also understood the level of threat that cholera represented, and he therefore had zero hesitation to make whatever accommodations were necessary, even when that meant permitting eating on Yom Kippur. Okay, now, although cholera patients who receive no assistance die in about half the cases, 99% of cholera patients who are properly rehydrated survive without antibiotics. The mortality rate with treatment was therefore in 1848 only about 1%. Okay, in contrast, as of today, we're guessing, we don't know for sure, but we think the mortality rate worldwide for COVID-19 is about 3.7%, more than 3 times higher than cholera. The COVID-19 mortality rate in the US is about 2.7%. And in places like Italy, where they failed to use social distancing, it's about 6.6%. Okay, now, we have no option but to rely on the medical establishment. Last Tuesday, March the 10th, Dr. Brian Monahan, he's the attending physician of the United States Congress and the Supreme Court. He told the Senate's administrative staff from both parties, in the presence of NBC News reporters, that he expects 70 to 150 million people in the United States to become infected with COVID-19. Chas v'chalila. That math would predict 1.9 to 2.7 million American deaths due to COVID-19, which, by the way, is as opposed to about 12,000 people who die annually because of flu, for those people who want to compare flu and COVID-19. Okay, now, I'm the first to tell you, this math is not reliable for many reasons. First, the data that we possess is of questionable reliability. Much of it's from the Chinese. We don't know what they were telling us, what they weren't telling us. The rest of it was gathered in a rush. We'll know a lot more a year or two from now. More, the epidemic began so recently that we can't accurately predict its course. And most importantly, Hashem is in charge. So we can't know what's going to happen. However, what's clear when we stand back and put our present circumstance into historical context is that the halacha applied to our present situation requires making whatever accommodations are necessary in order to protect our lives. Okay, let's move all the way up to current rabbinical responses. In direct response to the current crisis, the well-known Gadol who lives in Eretz Yisrael, Rav Usher Weiss, wrote, this is on March the 5th, "It is obvious and clear that people must precisely follow the instructions of the medical establishment." This morning, Rav Ovadia Yosef's son, Rav David Yosef, walked into his kollel and rebuked all those present, explaining the halacha requires that we abide by the medical experts' advice and the government guidelines, and there were more than 10 of them in the room, which violates the Israeli epidemiologist's guidelines for what is considered to be safe. Now, what's beautiful about this Maisa with Rav David Yosef is that there was someone there with a camera who shot a video clip of him rebuking his kollel. And that thing went wild on Israeli social media. And you can see Rav Yosef telling all the Avrechim to immediately take all of their Sfarim, take all their books, and get up and go home. And he encourages them to keep up their same learning schedule at home. But he says you can't study together in the Beis Midrash. It's forbidden, halachically forbidden. In my own kollel, the Center for Kehillah Development, we are, of course, keeping the guidelines set out by the Israeli epidemiologists and enforced by the government. We asked all students to study from home, learning b'chavrusa over the phone, and we set up all of our shiurim, all of our classes now through Zoom. And this technology is, since I just did it, I can tell you, it is so simple and so accessible that it took the CKD only about 4 hours to set up the entire satellite learning program. Okay, now, I'm the first to tell you, it is not as geschmack to learn through an electronic network. It's not as much fun. But let's be mature individuals here. It seems like a pretty small compromise compared to eating on Yom Kippur or the other links we would really have to go in order to protect human life. In this regard, I want to point out something which for some reason is not obvious to many of the people that I've been speaking to. We have to clarify that the potential isser here, the potential halachic problem, is not just suicide. It's not just that if I don't follow the guidelines that were set forth by the epidemiologists, I'm afraid I might get sick and die. And that alone would be a very serious consideration. The Talmud in Moed Katan 18a says that anyone who intentionally takes steps that lead to their death is considered so depraved that they're deprived of a eulogy. Like we do not honor such a person. However, the problem here may not just be suicide. It might be murder. Only about 19% of those who are infected with coronavirus show symptoms. But even those who are not showing symptoms, who are infected, still infect others. So it is entirely possible that my carelessness could lead not only to my becoming infected, but then my unwittingly passing the disease on to others who are in high-risk groups. God forbid I could unintentionally kill my parents or my grandparents, or someone with high blood pressure or asthma, chas v'chalila. We cannot take this risk lightly. Not if we consider ourselves to be observant Jews. This is not what the Torah taught us. Okay, people are asking, how long is this going to last? Which is another way of saying, like, it's so extreme and it's going to last so long, I don't want to do it. But let's talk about how long it'll last. So the answer really depends on how seriously we take the guidelines. If we follow best practices, washing your hands, covering your nose when you sneeze, staying away from people when you're not feeling well, staying in groups of 10 or less, if we follow these best practices, then in theory, by the way, notice I'm not talking about not ordering dinner from a restaurant and having them deliver it to your house. The Israelis have not banned such a thing. They haven't banned food deliveries. They're not worried about infection from an object to a person, even though in theory such a thing should be possible because the virus does live on inanimate objects. But the epidemiologists are not concerned about that. In their minds, in the minds of the epidemiologists, if we can just stop person-to-person infection, we can control the disease. And in theory, if the period from infection to symptoms would take a full 2 weeks, and we use the practices to minimize communal transmission, the disease could be gone in a month, even without a vaccine. And in contrast, if we don't follow the guidelines, the disease could continue to afflict innocent masses for many months, and it could kill hundreds of thousands or worse. Okay, so I've been told that the medical establishment is making these extreme statements and that we don't need to be so concerned. So I can assure you, and I think there's not a person listening who would disagree, that all those who are making the claim that the medical establishment is blowing things out of proportion, all of them live in places where the disease has only recently arrived. You and I know that no one who has spent the last week or two burying their dead in China, Italy, Spain, Iran, or South Korea feels that the medical establishment overstated the danger. They've got 20/20 hindsight. Okay, that pretty much summarizes my take on the current situation. I recognize there's lots of little detailed questions that I haven't dealt with, but that's why I want to do the call live with you. So if there are people who have questions, And I'm sure tonight there must be people who have questions. Please go ahead and do whatever you need to do to call in a question. David, what do they do next? Regarding what to do when there's more than 10 people in a minyan, so what would you do if it was Pesach and suddenly you discovered that there was a little bit of chametz on the table, on the Pesach Seder table? It's a little bit. It's only 2 extra people in the minyan, a little bit of chametz. So would you say, okay, listen, 2 extra people, it's a violation of an Isser Deraisa, Pikuach Nefesh, but it's only 2 extra people, so it's like chametz on Pesach. A little bit of chametz is not such a bad thing. So there, again, we could take the approach of like the liberal approach of saying, it's a little bit of violation is not such a serious thing. But what does the Torah say? The Torah says a little bit of chametz is a problem, and a little bit of not listening to the medical procedures is a problem, which is why in Eretz Yisrael, they've been really careful about having minyanim of 10 people, and when there's more than 10, they make them go away, come back at this time, there'll be another minyan. And they don't allow people to stand around in crowds. And again, it makes sense. If you thought it was cholera, then you would take it seriously. And the only reason that people aren't reacting to coronavirus as cholera is because it's new. And so we're in the middle of history happening, and we don't realize what's happening around us. So again, it depends if the people in the minyan are healthy, right? If you're in a minyan with 10 people and someone's coughing and sneezing, so that doesn't sound great. Oh, it also depends if you're in a high-risk group. The older somebody is, then the more risk there is, the more careful they have to be. The guidelines that were given for the public are for non-high-risk individuals. Someone has respiratory issues, they have asthma, something like that, then they have to be more careful. Okay, so it could be he wants to be a little bit more careful. There is, by the way, even if someone doesn't daven in a minyan, there's a halacha chiyuv to daven at the same time as the minyan. It's brought down in Gemara Brachos, and we do everything we can to daven at the same time as the minyan if for any reason we cannot actually daven in the minyan. All these are shaylas that you have to ask to your personal Rav. I'm just saying the most simple reading of the sources. Good. Another question? Oh, you're breaking up. I can't really hear you. Can you move your cell phone to maybe a place where you have better reception? So, it's obviously very personal. Is the United States safer than Israel? Right now, I don't think the United States is safer than Israel. However, if it's a choice of, let's say, hanging out with large groups of people in Israel versus spending time just with your family in America, then obviously spending time just with your family in America is much safer than spending it with large groups here. It really depends on the personal case. That every individual who's in yeshiva or seminary and is thinking of heading back into the United States has to speak it out with their parents and with their rabbi and see what makes the most sense. But overall, there's no reason at this point to say that the United States is safer from coronavirus than Israel is. And I would say probably the opposite is true right now. Yes, fantastic question. So the answer is like this. The guideline of 10 people wasn't put together because it happens to be a minyan. It was put together by the epidemiologist who saw that when gatherings were limited to 10 people, the disease didn't spread. Now, I personally don't know why 10 people seems to cap it. I don't know if the epidemiologists know why 10 people seems to cap it, but that's enough of a precaution to avoid the disease spreading. So once they came up with that, then at that point, that is the halacha. Coincidentally, that allows us to daven in a minyan, which is very nice. But it's not like we're saying because minyan is so important, we'll stretch it to 10. If they would have said 8, then we would have no minyanim today. Just so happens the scientists who are studying the disease saw that when groups were capped at 10, it actually prevented the spread of the disease. Good question. I haven't seen it, but I guess we'll find out. I don't know. I'm not an expert. I'm not a medical doctor. I'm not an epidemiologist. So I really don't know. But in my quick run through the data, I didn't see anyone saying that. You're welcome. More questions. Excellent. Okay. So first of all, I don't know if the Americans are actually arguing that the Israeli science is wrong. I think the American approach up until now has been, let's not alarm people. So let's make the minimal restrictions we can make and still try to make people safe. But it's not like I don't believe that right now there's an argument over the science. That I haven't seen. If it turns out there's an argument over the science, then in Echanami you could paskin by the scientists who are in in your country, and that should be fine. But I haven't seen that. That doesn't seem to be the case. And the Israelis are not just studying Israel. In fact, they're not studying Israel. The Israelis are studying the epidemics that are taking place in every country in the world, including the United States. So my thinking right now is that the Israeli standard is probably the state of the art. Good question. More questions? So again, I think what the halacha says, and this is what Rav Asher Weiss stressed, is you must do what the epidemiologists tell us is working with this virus. And the epidemiologists are not saying avoid groups larger than 10 if somebody is sick. The epidemiologists are saying avoid gatherings larger than 10, period. So if you say, but everybody in my minyan is healthy and there's 20 people, that's exactly the scenario where the epidemiologists and the Israeli government and the Rabbanim here in Israel have banned the minyan. It's where everybody is healthy. It's a group larger than 10. It's illegal. You can't go. And that's where Rav Asher Weiss said you have to follow the guidelines of the health authorities bekapdanut, with tremendous precision. Listen to exactly what they're saying. Good question. More questions? Your second question was about domestic help, having somebody come into the house and you don't know exactly what's going on in their home. So again, the epidemiologists haven't banned this. To have somebody come in and help you in your home is permitted by the Israeli law and by the epidemiologists here. The only thing you would want to do is you would want to ensure that they wash their hands with soap and water when they arrive, and that before you eat, or if they're going to be touching the children before they touch the children, again, they wash their hands with soap and water. Practice really good hygiene. Just be careful. And of course, you should ask them: is there anyone in your family who's sick right now? If there's anyone in their family who's sick, okay, so that's a bad idea then. But if they don't know of anyone in their family who's sick, and they're practicing, proper hygiene, so everything should be fine. There's no reason you couldn't have help come in. Okay, I think that might wrap it up for this session. I suspected that maybe there were some burning questions that we had to address, and so I'm glad we got some time on this. I want to stress to everybody that I'm not poskening for you. I was giving a picture of the way that things look to me when I look over the reality and the halachic sources, and everybody has to speak to their own private Rav and get personal guidance. Nonetheless, it could be that tonight's session at least sharpened your questions so you know exactly what you want to ask. Okay, I look forward to meeting with you guys next time. Hopefully next time we will not have coronavirus to worry about, and we'll be able to plow through a bunch of other questions. So I look forward to our next personal Inner Circle session. Have a good evening.
Copyright LawrenceKelemen.com. All rights reserved.